Hello everyone and welcome to our Michigan Medicine live event. I'm Dan Ellman with the Michigan Medicine Department of Communication. Drinking alcohol is not only common, it's socially acceptable, and in some situations, even expected. We meet up with friends for happy hour after work, we toast accomplishments and achievements with champagne. We tell the buddy we haven't seen in a while that we should grab a beer and catch up. However, alcohol is also widely abused. Drinking too much can increase the risk of injuries, violence, and certain health conditions. Alcohol's socially acceptable status can also make it hard to evaluate our own use or the use of others. Today, I'm joined by Dr. Ann Fernandez, a licensed clinical psychologist specializing in substance use and health psychology, and Lori Schulman, a licensed clinical social worker from the University of Michigan Addiction Treatment Services, or UMATS. The pair are here to discuss alcohol use, how to determine if you have a problem, strategies for cutting back, and treatment options for those struggling with addiction. Thank you both for joining us today.
Thank you.
Now, before we jump in, I'd like to remind our viewers that you can submit questions at any time, even now, for our panelists to answer during today's chat. Questions can be submitted by commenting on this video, but please note that your name or profile name will be visible to others participating. If you prefer a more anonymous option, you can send a private message to us via our social media pages. And if you can't stay for the whole chat or want to share the recording afterwards with a friend, a video of the chat in its entirety will be made available on our Facebook, Twitter, and YouTube pages for sharing. So let's start with our first question. How would I know if I'm abusing alcohol as opposed to just wanting to grab a couple drinks?
Yeah, that's a good question. I think Lori and I probably both have some things to say about this, and there isn't always a really clear black and white answer, as in we can't say at this number of drinks for you that's a problem. So the person really has to do a self-assessment of what's going on with them if they're asking themselves that question. And things that they would likely want to ask themselves is alcohol causing problems or causing a problem for me in my life? And areas where alcohol frequently can cause problems for people are in domains such as health, social relationships, emotional functioning, sometimes legal or driving related consequences. So if people are kind of hearing those things and kind of ticking boxes in their heads like, oh yeah, someone's mentioned to me that my alcohol seems a little out of control. And yeah, I did get pulled over once, or my hangovers are really getting in the way of my schoolwork. All of those things are indicators that something might be going on, and there's a huge range of severity of how an alcohol problem can get in the way. We used to kind of think more in a binary way in terms of like abuse, dependence, but now we see alcohol problems really occurring on a spectrum from more mild problems, like maybe a few problems in life, to really severe problems where, the person's entire life is really involved around alcohol. It's really out of control. Job loss, financial problems. So it doesn't have to be I'm an alcoholic or I'm not.
Right.
It's really a big spectrum of problems that people can experience. And I encourage people to think about it in that way so that they don't feel they have to put themselves in a box, just to recognize that maybe their alcohol use is causing some issues that they're not so happy with.
I would just add that I agree with all of that, and especially from the adolescent perspective. That's more of what I work with. There's times in adolescence and also young adult college students, for example, when binge drinking or drinking more excessively becomes more socially acceptable, that can make it harder for someone to tease out if as standing out from one's peers is an easy or maybe a more obvious sign, but that's not always going to be true at different stages in our lives. So kind of like Ann mentioned, catching that this is a problem before there's too many events or consequences is good. And I think asking the question in itself is a sign that somebody, you're open to wanting, you're open to the idea that your habits could be helping your health or detrimental to your health, and that's what we're here for at UMATS, the treatment services. It's University of Michigan Addiction Treatment Services is what the acronym stands for, to kind of help you figure that out.
Well, and I think so, sort of following that response, are there any specific warning signs that somebody has moved from casual drinking or socially acceptable drinking to having a problem?
Yeah, I mean, there may be some, but they may vary depending on the person. So some people have consequences associated with alcohol early, and some people who I've met who have been drinking for a long time kind of deny having a lot of problems. So it's a little hard sometimes to say this is what's going to happen for you.
Yeah.
But things or warning signs that people could look out for is if they're noticing they're developing tolerance, needing more and more of the same substance to get the effect. That can be a red flag for people, or at least indicate, you know, there's something habitual happening. And then also, if they're finding they're out of control. And that can be as simple as, I intended not to drink a certain amount on this given night, and I went over that, and that seems to be repeating itself. That can be a red flag, like, I don't quite have a handle on this.
I can't stop myself.
I can't stop myself. At least to, you know, for my own self-set goals, I seem to be continually going past them. And then sometimes for people, it might be from the outside that they hear warnings that something's going on. So kind of to be keen and open your ears and really hear if a peer or a family member is saying, hey, I'm kind of concerned about you. There may be a tendency to be like, oh, they just don't get it. They don't get my life. But to kind of consider where they may be coming from, because sometimes the first people that bring the problem to your attention are actually someone in your life, not yourself.
Right, I would also just add that we talked about problems associated with alcohol, but when you have an attachment or you're still gaining some type of pleasurable response, or even a nostalgic memory of a pleasurable response to the substance or situations associated with it in your life, it can be difficult to attribute any problem to the substance. It's kind of a bias towards, I don't want to give this up, so there are always many factors creating the appearance of a consequence, such as maybe a problem with authority or the police, a problem with a school, so oftentimes some of the warning signs might be missed because the person might not be attributing them to alcohol, even though alcohol could be exacerbating them.
Gotcha. Now, are there actually any health benefits to light or moderate drinking? You know, you could read out there that maybe white or red wine in moderation is good for your health. Is there any truth to that, or is that a myth?
Yeah, this is a tough one. So there has been, without getting into too much detail in history, there's been a long-standing body of literature that often associates lighter drinking with some health benefit. But recent, very wide-scale studies that have been published in premier medical journals have largely debunked that association, or found the consequences of even light drinking actually kind of cancel out any potential benefit cardiovascularly. So, like, it increases the risk for breast cancer. For something I'm doing research in is some surgical complications. It can cause weight gain. It can cause a lot of other things. It can exacerbate diabetes. So when you kind of look at the whole picture, and when they've done these really widespread studies, there aren't a lot of health benefits that can be pinned down. And usually if there are, they're just less risk and at a very, very light amount of drinking, often even less than a drink a day. So it's kind of a bummer of an answer, but that's what
bringing some people down,
but that's the most recent data have shown that.
Okay. Now, let's say you're a parent who drinks fairly regularly but not heavily. Is it okay for them to drink around their kids?
I think that's a good question. It's important to state that medically we kind of know that the adolescent brain is developing a little bit longer than a lot of people realize, because you become a legal adult in some ways at 18, and then at 21 you would be legally allowed to drink. So, but actually adolescent brain development can go till 24 or 25, so that's just something to note. I think the key issue with parents that I've run into is realizing that alcohol can impair your judgment, your driving, your caring for an infant, and I wouldn't say that there's always a danger to drinking around a young child, although we know that youth learn more by example, kind of their parents are more role models than what the parents might say, but it's just making sure that there's another adult there who is sober, who can transport it to a doctor if that's needed, kind of respond to emergencies. And so just viewing it kind of like I'm going to be taking a nap during that time, so I'm not at the same level of ability to supervise my child as I might be if I was sober.
So if it doesn't get in the way of your parenting responsibilities, then there's not necessarily an issue with it.
Right. I think it's like overt things that get in the way of a parenting responsibility are harder to detect. I mean, we don't want to wait until sort of some things that happen to parents who are doing everything by the book as far as responsibility, drinking at home, no need to go anywhere, but somehow have to stop, pick somebody up at the airport, stop, take a child to the ER, stop, respond to something. It's just kind of remembering that with kids things are unpredictable, and all children, need a competent adult there to protect them. So it's important to think preventatively too, as well as reactively in that situation.
Yeah. Now, when I go to the doctor for a physical or just a general checkup, one of the questions on the form all the time is, how much do you drink on a regular basis? And maybe Dr. Fernandez, you can answer this. Why do doctors need to know that information?
Oh, that's a very good question, and one near and dear to my heart, because part of my work has also involved alcohol screening and how do we do that in medical settings, and what's the best way to do that.
Yeah.
And doctors need to know that information for a lot of different reasons. So some of the things that I had mentioned were alcohol can impact diabetes, cancer risk. You can have acute effects of alcohol from being intoxicated. It can just it basically impacts every organ system, cognitive functioning, all of these things. These are health issues. And I think that a historical divide between addiction and health or medical services really has continued, and we're bridging that now when we're bringing addiction into the hospital settings and this kind of thing. But historically, addiction's been treated separately, so we don't always think of them in the same way. But alcohol use is just as much of a health condition as smoking, as what we eat. So I really encourage people when their doctor's asking that to think about that as information and data that their doctor needs in order to manage their health most effectively. And as much as it feels private and it is stigmatized, the medical setting is a place where hopefully someone feels like they could be honest about that. But it's a challenging thing for sure.
Yeah. Now, if you want to cut back on drinking but find it really difficult, does that mean that you have an addiction or a drinking problem?
Well, in that situation, that's a good question. I think a lot of people ask that question. But that in itself, trying to make a change, but finding it more difficult than you anticipated is, in a way, a problem, but it's not necessarily a problem that means, like Anne said, like a binary diagnosis of I have a problem or I don't have a problem with implications. It's more a sense of, okay, this is more challenging than I anticipated, so what other measures do I need to take strategically that I might be successful? And sometimes it requires additional effort or thinking or an outside help from a professional to help figure out why something that seems like it should be an easy thing to do is difficult.
Yeah.
So,
and I think just asking yourself that question, as we were saying, there is this spectrum of severity in alcohol problems, and anyone's sort of personal reference point of where things just don't feel healthy for them anymore may differ. So for someone that might be really a light amount of drinking, and for others it might be heavier. So just questioning it doesn't mean that you have a problem. It's just sort of where your set point is. And some people choose not to drink, and if they're in their family and friends drink heavily, they might feel like that's unusual, or maybe they don't have a problem. But if for them personally, that's not what they want in their life, I also encourage people to feel comfortable to make the choice that works for them.
Yeah. So what strategies are out there to help sort of cut back in the amount of drinking that you do? Do you have to, is it as simple as avoiding situations where there is alcohol present, or are there other strategies out there?
I think the strategy, and Dr. Fernandez can say more, but should be tailored to the individual. And it is helpful to have somebody who's helping you, who is a neutral party, like someone who works with you in treatment. So just emphasizing that treatment is not just for people who've self-identified that they have a problem, but also those who want to sort of preventatively minimize later problems once they notice that stopping or cutting down of a substance is more difficult. Also, back to the previous question, that information given to a health provider can also be especially helpful in psychiatry to minimize false diagnoses or false or not fully accurate diagnoses, because any substance that can be abused or that stimulates pleasure or dopamine is going to create a little bit of a roller coaster going up and coming down, which can mimic things like bipolar at times. And as far as strategies, I think there's some people who are able to moderate with strategies, and there's other people who find that they cannot.
Yeah, I agree. I think there's going to be a menu, and when we're speaking to a broad group, it's hard to say, this is exactly what might work for one person, but definitely I think avoiding situations where alcohol is taking place for some people is really necessary. Mm-hmm. People often underestimate the environmental impact and the habits have on drinking and other behavior and other addictive behavior. And so sometimes, especially in the beginning, getting yourself out of situations where you habitually drink is really key until you've gained some abilities and other skills and confidence in managing not drinking in those situations. But I'd also encourage people to look, there's great resources online, even websites to find information. There's apps for even alcohol management and tracking. There's, NIAAA, the NIH Alcohol Institute has information, SAMHSA, and then there's obviously more formal treatment resources. University of Michigan has an alcohol management program that can help with kind of more moderate to problem drinking. More dependent drinking probably needs a more specialty treatment kind of situation like UMATS, which we can tell you more about.
Yeah, absolutely. We'll touch on that a little bit later. But real quick, going back to sort of the situation, like you said, removing yourself from situations where there's alcohol present. Let's say, all your coworkers are going out for a drink after work and you don't want to miss out on that, or it's your friend's, birthday, 40th or 50th birthday party, and everyone's going to be there. So you can't really avoid a situation where there is alcohol present. What sort of strategies would you suggest to avoid drinking either at all or drinking too much?
Sure.
Some things that have been anecdotally helpful for patients are just kind of planning ahead, such as the role of replacement beverages, accountability, building that in, such as having a sober buddy. Sometimes people perceive that they might be the only one at a gathering not drinking, but that may not be true, as well as having an exit strategy, which would only kind of be safe if you weren't drinking or in a way, sober enough to drive. But things like that can be helpful if you feel like you absolutely have to be in a situation. A lot of people become hyper-focused on what will people think of me if I'm not drinking, and find that in the reality is that a simple answer of no thank you or I'm good works, and you don't necessarily have to feel like you have to tell your entire story in response to that question. So.
Yeah, that's a good point. I do think having a beverage, if someone really wants to go out and doesn't want to drink and doesn't want to have pressure, sometimes just having a beverage in your hand. A lot of times people are doing things to be polite and they just want to make sure that you have something. So sometimes just having something in your hand is enough to fend off
the questions, right?
Yeah, exactly. So that can be helpful. I also recently read a book that I really liked called Sober Curious. And one of the things that the author wrote about that I liked and I've talked to with patients are called sober firsts. So the first time you go out to do something that you normally do when you're drinking, and how getting over those humps is kind of difficult, but often you're surprised that, a lot of people aren't drinking and I never noticed before. I still felt confident after I'd been there 20 minutes. It wasn't actually the alcohol that was doing it. So, so some of these things that, try the sober first and kind of see how it goes. But
some things you attribute to alcohol use and it really has nothing to do with that at all.
Right. Some of it's just time.
Yeah.
And they call liquid courage, but it's actually just your own courage slowly, working its way up as you
Getting more comfortable in
yeah,
the situation,
yeah,
whatever
exactly.
it is.
So sometimes
Yeah.
people can learn that after kind of giving it a try.
Yeah. Now, this is something that probably would affect a lot of people and a lot of our viewers. How would you talk to a friend or family member who you suspect has a drinking problem?
I think the question, across a lifespan, there's some common themes, but for adolescents, it can be helpful to approach it in a kind of a academic or intellectual way. Like, have you ever, depersonalizing the question a little bit, have you ever known anybody that you thought had a drinking problem or a use issue? Like, what would that look like to you? And then kind of as you notice that your child or friend is feeling more comfortable, kind of moving in to talk about personal experiences, maybe sharing some of your experiences. So that can kind of prevent being perceived immediately as judgmental or trying to label somebody.
Or accusatory?
Yeah, exactly.
Yeah.
Yeah, I agree. I think a lot, especially, there's definitely a way of communicating with people about sensitive issues that can open a conversation or dialogue or close it down. And really confrontational, accusatory language can really shut that down quickly. So I do think, even though you may be, in some cases someone may be angry about the other person's behavior, but using I statements, this comes up in a lot of different areas. I feel this way, or I've noticed this, can kind of diffuse defensive-ness. And then also, I think reminding the person that it comes from a place of caring. That I've found even in clinical practice when having to talk to people about what's going on, where they've maybe concealed information, and I'm trying to talk to them openly, is reminding them, like, this is for your care. This is like, we care about you. The clinic cares about you. We're trying to help you. Can kind of facilitate movement on tough discussions.
Yeah. So let's say you're hosting a party where alcohol is going to be served, and this could be for young patients or others, or young viewers or others. How do you discourage heavy or unhealthy drinking at that party?
I think it's important just to note that there's no safe drinking for those who are still having it in their adolescent brain developmental phase. So, and that while you can do some tactics, which Dr. Fernandez can comment on as well, there is a limit to your discouragement. Certainly you could limit the amount of beverages in the home, but people can sort of order more now online without much difficulty. There are some people who will be totally on board with drinking at sort of a safer level or not going overboard, but then once they begin to drink, their judgment changes. They become less on board with that initial goal.
Yeah, that's a really good point. I think, I guess I think it is important to start with, you don't have complete control over other people's behavior. So if you're going to have a party where there's alcohol served, there's a chance that could happen. So I think kind of accepting that or knowing that to begin with. But from there, you can do things like you can have a time limit to the party, have a time when the party ends. So because as it gets later and people drink more, it can become more problematic and more likely the number of hours and number of drinks you're going to run the risk of that more. Make sure there's food. I mean, think of a lot of like traditional big college parties. There's no food, it's just drinks. So have food and think about the types of drinks you serve too. A lighter beer. Some microbrews have a hugely high alcohol content. You could have one drink that's actually 2 standard drinks in one bottle of beer, depending on the alcohol content. So think lower alcohol, trying not to have as much hard liquor, potentially trying to serve the alcohol yourself. I mean, you could regulate if you had a bartender type situation. That's kind of a lot of extra work, but there's some creative ways you can kind of help manage things, but then also knowing that you don't have control over what everyone's going to do. So if you really want a party without those consequences or risks, you'd probably want to try an alcohol-free party, which is a choice that people can make as well.
Yeah, I would just add from my personal experience and professional experience where there will be parties that I've been to which are professional or personal, and alcohol is part of the theme of the party. However, there are no alternative beverages provided at all.
That's a good
So
point.
I think that it's helpful to remember that even at a gathering where drinking is acceptable or it's been done before, or happy hour, just having pop and water available, because hopefully people will bring their own alternative beverages, but some people might not think of that, and not everybody likes to drink.
Yeah.
And again, having that alternative if someone just has a drink in their hand,
Yeah.
and it lessens the questions from people who don't want to drink.
Yeah, definitely.
All right, so we touched on this a tiny bit, but let's go back to it. What types of addiction treatment and services are offered through U of M?
Yeah. So you can
No, go
start.
ahead.
So Lori and I both work at the University of Michigan Addiction Treatment Service, which is UMATS. And I work with adults in the program, and Lori you work with adolescents, but adults as well. So we have an adult program and an adolescent program. It's through the Department of Psychiatry, and it's housed at the Rachel Upjohn building on Plymouth Road. And essentially, our most intensive level of care that we offer is called an intensive outpatient program. That particular program is abstinence-based, abstinence only, so you have to be abstaining from alcohol and drugs to participate. And it meets 3 times a week for a half a day for 4 weeks. So it would be a rather intensive program for depending on what you're looking for, and is appropriate. An assessment would tell us whether someone was appropriate for that group, but that's one of our options. And we have individual outpatient working with psychotherapists. We have psychiatry that does medication management as well as medication-assisted treatments, which could be for alcohol or opioid use. And we have a lot of group offerings, which can supplement individual therapy or could be standalone. So we have an early recovery group, we have a cognitive behavioral therapy for addiction group, we have a group for people who are on medication-assisted treatments, and we also have a dual diagnosis group, which is for individuals who have depression and anxiety and also have a co-occurring addiction issue. And we actually have support and family groups as well. So not only people who are experiencing addiction themselves can be patients at our clinic. So you could also get help if a loved one is experiencing that. And Lori can talk a bit more about some of our other programs. We have a health professional program as well, so it's specific to people in the health fields who are struggling with addiction. And some people are more mandated to take part in that, but you can actually also take part voluntarily. Yeah.
We have a couple of adolescent groups that are differentiated by, one is more like a class, and it's for youth who are maybe not motivated yet to change, but somebody else, like a parent or a school, has identified a concern. And then we have a group for adolescents, an outpatient group for young people that are motivated to make some kind of a change, and we do what's called motivational interviewing, which works with the motivation that somebody might have to make some kind of a change in their life and kind of help provide education into how cutting down and usually sometimes stopping the substance use. It's tailored to the individual, but in general for that type of a group, how stopping the substance use or substance use in one's life can aid them in their personal goals.
Going back to the intensive outpatient program, what do those half days look like for those involved?
That's 9 to 12 on Monday, Wednesday, and Friday, and I think it's just a component of group therapy, psychoeducation, which is a fancy way of saying kind of education about empirical information and how to apply it to a personal situation, an element of coaching, an element of supporting each other, and then those peer interactions can be in themselves healthy. And for adolescents, and especially young college students, they might not be having natural dialogues with others who are trying to abstain from substances. So that is good to have access to such an environment.
Yeah.
How are these programs different from something like Alcoholics Anonymous?
Yeah, that's a really good question. So Alcoholics Anonymous is, in and of itself, it's group group-based, and it's a support program that's run by other people who are also struggling with alcohol. And it has some really unique components, like the incredible level of social support, the availability at any day, and sometimes it seems like almost any time.
Yeah.
It has a strong spiritual foundation that a lot of people really benefit from. But it's sustained. The organization is sustained and run by its members, so it's not truly a psychotherapy or treatment. So this is going to be, UMATS is going to provide services that are in much more of a psychotherapy treatment-based setting, and it is run by clinicians rather than peers. And we have group-based programming, but some of that programming is a little more counselor or therapist-led as opposed to sort of group-based discussion or presentation. And so it may or may not, also the groups or individual therapy may or may not include kind of more skills and tailoring to the individual. And I'm trying to think if there's other big pieces I'm missing.
I think you covered most of it. Just being housed in the Department of Psychiatry, like you mentioned, again, means that we're kind of working on the other co-occurring issues that go on as well. A lot of our patients are seeing psychiatrists, so just how to deal with sometimes issues like depression and anxiety can get worse before they get better when somebody makes a change. Normalizing that, we really support patients who want to attend mutual support meetings like AA, as well as there's a number of other type of mutual support meetings in the community that people might not be as aware of, like Smart Recovery, which is more secular, Refuge Recovery, which is more Buddhist, and then youth-friendly meetings, and we can provide information about that too.
Yeah, another important distinction I think between some of the psychotherapy components and AA is there is some, well, I guess AA has this as well, but we're also very motivated to meet people where they're at. So some people may not quite be ready for a very heavy abstinence-based message like the one that comes across in AA. And so we do have people who come in who sometimes aren't sure. I mean, just questioning your alcohol use and thinking, do I want to have a lifelong abstinence in front of me? I'm not sure.
Right.
Do I want to cut back right now? I think so. I'm not sure how to do it. So we'll also work with people either one-on-one or in groups to try to figure out what their goals are. As professionals and having training in this area, we're also going to give feedback about whether we think those goals are realistic.
Okay.
Sometimes people come in with sometimes ideas that through our experience and training, may not be as likely to work, but we'll work with people. So I also like to get that message across that that's sometimes a difference that people may see with some of the therapies as opposed to an AA model.
Okay. So let's say you're a U of M employee or a Michigan Medicine employee and you want to generally cut back on drinking. What are the specific services or programs available for employees here?
Well, we have the, like Rose mentioned, the alcohol, what is it called?
Alcohol management program.
Right.
Yeah.
It's formerly called DrinkWise, I think, but they, so that's for people who are saying, I don't think I necessarily, we work with that program, so somebody might come in curious, about if they can moderate their drinking or do it in a more skillful way and avoid certain consequences, but then if it becomes too difficult, the moderation program would refer the patient to us maybe for further help. And then we definitely just try to work with people where they're at, like Ann was saying, to increase awareness and
What would you say to employees who are maybe concerned about getting assistance from their employer?
That is a very good question.
Just that HIPAA still applies. There's protection for employees so that extra steps have to be taken where anybody going into their record has to verify why and who they are, just to kind of protect employees from knowing that there is a separation between their kind of employment file and their health patient information. There's like federal protections of privacy between that. I think some people do just feel less comfortable because of the kind of closeness to home, or they might run into a colleague while they're in a waiting room in a different clinic. And so certainly people can access other services in the area like St. Joe's but we do everything we can to help people feel comfortable, and that's a really common thing.
Right.
Yeah, a lot of people work for the University of Michigan and struggle with these issues. And so we do have those services if people choose to take part in them, because we have the health professional program as well. There's also some designated groups where they could actually work with health professionals who maybe have some ways that they can empathize with what's going on. So that's an advantage. I believe there's even an AA meeting that's health professional specific,
okay.
that's through the hospital. So there are some unique resources that people can take advantage of, because I mean, it's people who work at the university struggle with the same issues that everyone else does.
Yeah.
And yeah, there's always alternative programs if it's too close to home.
Can you reverse any of the negative effects of heavy drinking?
I would say that for adolescents, and just I think for adults across the lifespan, reverse would be an inaccurate term, because sort of a neurotoxin, or any kind of, to say it in simplistic way, like damage done to the brain can't be really undone. However, kind of like if you have a stroke on your right side, your left side can learn to adapt, to develop more, to compensate. So, and I think that different stages of life, it's different, but we can definitely help build is it called neuroflexibility? Or like, we can definitely help patients to build skills in response and kind of maximize their health in multiple ways.
Yeah, I agree. There are certain aspects, I think, of a heavy drinking and maybe the consequences that can take place that you can't undo. You can't undo a car accident. You can't undo a socially damaged relationship potentially, or an injury. Although there are impacts of alcohol use that are reversible to some extent, like in some of the medical areas that I work in, some of the immune depression that might take place from alcohol use if you stop drinking for a month, that can significantly improve. So, and even your tolerance that you can build up to alcohol use if you stop drinking for even a few weeks, that can go down quite a bit. So, so there are things that are reversible in that sense, but
Right.
I also agree that there are sort of things that you can do while drinking or to your body or your brain that you can't undo.
Yeah. If you have a loved one or a friend going through recovery or treatment services, what's your best advice on how they can be a good support system for those people?
I think that's a great question. I think there's mutual support meetings for families in the community, such as al-anon, which is for friends and family, loved ones of those who identify as alcoholics. Then there's nar-anon, which is sort of a partner to NA, Narcotics Anonymous, for families and loved ones of those who use other substances, narcotics, but also other drugs. We have parent support groups available and a lot of family support that includes spouses and all different types of relationships. So I think just becoming educated, and then sometimes the caregiver burnout or the stress on other individuals in the family who are trying to kind of manage this problem,
Right.
as it might be getting worse or appearing to go into remission and then flaring up again.
Yeah.
It's always helpful and important to remind family members to get their physicals done and their regular self-care in medical ways and other ways, and just to take care of themselves is important too.
Yeah. There's a book that I've sometimes recommended to people as well called Beyond Addiction, that has some interesting information too about helping and caring for a family member.
I think self-care for that family member is really important, right? It's causing stress. It's adding this extra level and complication to things. And you need to be able to, if you want to help someone else, you have to be able to help yourself too,
Yeah.
right?
Yeah.
Yeah. If there's one takeaway you would want viewers to get from this conversation, what would it be for both of you?
I guess that if you're wondering if you have a drinking problem, a problem with drinking is simply a problem that could be exacerbated by alcohol. Try not to think in terms of a black and white. And then the sober curious movement that Anne brought up is that sobriety has health benefits and can be life improving or life enhancing for people regardless of whether or not they identify with having a problem.
Yeah, I would agree with all of those things, and also add that I do really encourage people to try to think about alcohol problems in a health sphere. I think so often they cause so much social and emotional turmoil that we forget at the end of the day that they are medical conditions, they are health conditions. They're extremely stigmatized, but just like any other problem, there are things that require treatment, and you can have a mild problem and get help, or you can have a serious problem and you can get help. And that's not necessarily something to be ashamed of, although I totally understand why people feel a sense of shame because of the historical stigma of these problems. So I would encourage people, even if they have a mild problem and they're curious in getting help, to potentially get treatment or seek out resources. We often find people wait until very long into their addiction to actually reach out and get help. And ideally, preventing some of that damage that addiction can cause is better. So getting into treatment earlier is better, and you're more successful the earlier that you seek treatment. So I really encourage people to do that and to use the resources that are available and that will be on the website.
That's great advice. Thank you so much. We're closing in on the end of our chat together today. Thank you to our experts for sharing your expertise and your knowledge. And thank you to all of our viewers. If you're interested in sharing the recording of today's chat with others, you'll find it on our Facebook page later today and on the Michigan Medicine YouTube channel shortly thereafter. Again, thank you so much for joining us, and have a wonderful afternoon.